Variants increasing across Canada. We know that. What do people need to take away, though, from it?
That this is almost a brand new pandemic. This is not the same disease we've been dealing with for the past year. The new variants are a dire threat. They're hyper-transmissible, as has been noted, maybe anywhere between 60% and 100% more transmissible and lethal. And so our old mitigation strategies might not be sufficient. The old mask you've been using might not be good enough. A better mask is required. And limiting our exposures more than ever before is important. Keep in mind, though, the vaccines will still work against most of these variants. So our best bet to get out of this quickly is to restrain ourselves from unnecessary exposure and to ramp up vaccination as much as we can.
And I know the variants sometimes take a while to identify. So, the numbers that we're looking at right now in large part are probably not even accurate.
That's right. There's a rapid test and a slower test for the screening process. The rapid test is looking at the PCR and figuring out if one of the genes didn't quite trigger, and we can get that in 48 hours. The deeper genomic surveillance takes about 2 weeks. And so the data you see reported from much of the country is sometimes behind by several days. And Ontario is famously the slowest in reporting our data. Alberta is probably the fastest. So anything you see is an underrepresentation of the true burden of the variants in our society.
We're going to show the number of people who've been vaccinated as of 3 o'clock, which I'm just checking the clock here off camera. It's about 13 minutes ago. And we are closing in on 4.1 million Canadians who have received their first jab, and represents 10.75% of the population. So this race, Dr. Deonandan, between variants and vaccines.
This is the race, absolutely. And 1 dose is great. 2 doses is better. Look at places like Israel that have done more than half of the country, and they're seeing a decline in transmission, or the UK that got out of their B117 ordeal fast by vaccinating at scale. This is our best tool, and we really have to put our foot on the pedal and accelerate this as much as we can. So vaccine hesitancy concerns me slightly. If we have available doses and people aren't stepping up to receive them as their time, that slows down the overall process and extends the suffering of the population unnecessarily.
We're going to bring up our map, as we often do, just to give our viewers a sense of the number of new cases per province. And we do see, obviously, concerning numbers in Ontario and Quebec, as they are now surging forward, higher than we've seen in recent months. What about the vaccine hesitancy as well? And there's so much information flying around. People are going to look at that map. They're going to see the cases going up. They're going to look at the numbers, more than 4 million Canadians. But some will still be reluctant.
Yeah, because they don't know of someone personally who has suffered this disease and don't see themselves at being at risk of suffering with this disease. And that's the wrong way of thinking about this. Every day you spend unvaccinated is a day that you're at risk of getting COVID, and therefore at risk of being hospitalized, at risk of long COVID, and at risk of dying. So it's in everyone's individual best interest to get the first vaccine you are offered as quickly as you can. Remember, this is a population level game, not an individual one. So some people are tempted to wait for the better quality vaccine, if that's a thing, and that isn't a thing, rather, but people do think that way. Whereas if you get a shot in your arm as quickly as you can, and everyone thinks the same way, the population reaches herd immunity faster, and we all win. So this, again, is our best way back to normal, is for everyone to get a shot as quickly as we can.
How much of a cause do you think of vaccine hesitancy, Dr. Deonandan, is also just the mixed messaging out there? Whether it's about AstraZeneca, whether it's about the effectiveness. We're all kind of, amateur doctors nowadays, unfortunately, because, sometimes we're taking away the wrong information here, or we're not getting the full picture of what's going on.
Oh, yeah, that's a huge part of it. Probably most of it is the improper and clumsy way that some of this stuff has been communicated. AstraZeneca in particular has done an atrocious job. In early on their randomized controlled trial, the manufacturer made some errors. The dosage was inappropriately done. The clinical trials were not fudged, but just done sloppily. And now with reporting recent efficacy data out of the USA, it turns out they reported interim data that wasn't the final data. Then, of course, we have in Europe the clotting issue. That was not responded quickly enough by the manufacturer in terms of measuring risks. It's been atrocious. And I don't know what to say now, except that it's up to science communicators like myself and my colleagues, family doctors and so forth, to explain what risk and reward really are. The risks posed by vaccines are minuscule. The potential rewards are extraordinary. And risk is never zero, but we all have to do that individual calculus ourselves. And when we do so, we will find that it is in our best interest to get vaccinated quickly.
Yeah, important to hammer that message, and I do appreciate what you're saying about the messaging that has been atrocious on a number of fronts on all of this. Dr. Deonandan, thanks so much for taking the time. Good to see you again.